So hello everyone, and thank you for tuning in to IFFGD's Research Award Winner Series, Where Are They Now? This program was designed not only to acknowledge this year as being IFFGD's 30th anniversary, but to also give us a chance to reconnect with some of our past Research Award winners. Speaking of, today we have the pleasure of speaking with Dr. Gary Mawe, who was our 2013 IFFGD Research Award winner for Senior Investigator in Basic Science. Thank you so much for joining us today.
It's great to be here.
Yeah, so can you tell us just a little bit about yourself, where you're currently located, and a little bit about your current research focus?
Sure. So I'm at the University of Vermont in the Department of Neurological Sciences. So by training, I'm an anatomist, PhD in anatomy, postdoc in physiology and pharmacology. And I ended up coming from Columbia University, from Mike Gershon's lab there, to the University of Vermont back in 1988. And I've worked my way up through the ranks here at UVM, and I have a joint appointment. And so my primary appointment is neurological sciences, and I have joint appointments in the Department of Pharmacology and in the GI Division of Medicine.
Yes, that's such a cool background. So can you just tell us just a little bit about how winning the IFFGD Research Award in 2013 may have impacted or helped influence your career?
Sure. Well, biomedical research is a great field to be in, but it's a tough field to be in. And any time that you receive an acknowledgement from your peers and from an organization like the IFFGD, it's a real shot in the arm. It's one of those things that it keeps you motivated, and it keeps you your outlook positive, so that you feel like you're doing well and you want to keep doing it. And so that is one thing. Also, those of us in research are often in a situation where we're better known outside of our universities than at our own home universities for our research. And to receive an award like this, a prestigious award from an international foundation, is really great for me here at UVM.
Yeah, and just to get that acknowledgement and be acknowledged by your peers, I'm sure that that was just something that's very gratifying and rewarding to kind of feel, huh? Yeah.
Very much so.
Yeah. So can you tell us some of the research topics that you guys are currently focused on there in Vermont?
Sure. So we're doing a few different things right now, and I'll just try to summarize them quickly. One of the projects that we are working on is related to 5-HT4 receptors. And as many people watching this video probably know, 5-HT4 agonists, or drugs that stimulate the 5-HT4 receptor, are some of the best drugs for treating constipation. And in 2012, right around when I was receiving this award, and it might have contributed to that, we published a paper showing that 5-HT4 receptors are extensively expressed in the epithelial layer, or the inner lining of the intestines. And that if you stimulate these receptors, you get better motility. And this was a critical discovery, I think, because some of these drugs that hit that receptor have been associated with adverse side effects. Some of the newer ones are very safe. But our discovery that these receptors are on the inner lining of the gut brought up the idea that we proposed at the time, that maybe you could design drugs that are not absorbable. So they don't go into your bloodstream and hit other targets, but they stay in the lumen of the gut, have their effect, and then you poop them out without side effects. And so after that study, we discovered that stimulating those same receptors is good for treating colitis. Since then, we've entered a partnership with Takeda Pharmaceuticals and have been testing drugs that are non-absorbable that hit this receptor. And we have a paper coming out in April, I think it is, showing that these drugs that don't get absorbed into the bloodstream are really good at promoting gastrointestinal motility. So it's possible that someday drugs could be designed that hit that receptor without being absorbed and would be safe and maybe more effective than the currently available drugs for treating constipation. Another project that we're doing has to do with the microbiota, which everybody is a buzzword, everybody's excited about this. And this is related to probiotics. So probiotics are a mixed bag situation because there's some evidence that they are really helpful. There aren't a lot of really solidly done placebo-controlled double-blinded studies of these compounds. And it also, in many, if not most cases, it's not quite clear how they work. So we're working on a project in which we're using bacteria with a known biochemical property to see if we can affect gut motility. And what we're doing is we're using bacteria that produce tryptophan, and tryptophan is an amino acid that is the building block to make serotonin. It does other things in the body, including being incorporated into proteins. But this is the building block for serotonin, and serotonin is one of the key signaling molecules that promotes motility and secretion in the gut. So we've been testing whether giving mice bacteria that make tryptophan alter serotonin levels in the gut, and if they change the motility in the GI tract of these animals. And this is a strain of bacteria that's known to be safe. It's used in probiotic formulations, and we're getting some really interesting results and promising results. So this is the kind of thing that's exciting, where we would be using a probiotic bacteria for a known property of that bacteria to have a kind of a predictive action. We're also doing some work related to multiple sclerosis. People with MS often have constipation as an unfortunate side effect or symptom associated with their disease. And we're trying to figure out why people who have this demyelinating disorder of the central nervous system have GI effects where the enteric nervous system doesn't have myelin. So why are their GI tracts messed up? And what we're finding is that there are changes within the bowel, and that this is probably due to an autoimmune kind of collateral damage from the inflammatory response in the central nervous system of these people. And then the other project that we're working on is related to gallstone disease. We're trying to understand gallbladder smooth muscle function and dysfunction, and why the muscle stops working as a critical step in the development of gallstones.
Yeah, and just out of all of the things that you're really talking about, all of these categories have symptoms related, well, patients have symptoms, and that have dramatically can impact the quality of life for each one of the patients suffering from either constipation or the motility disorders. So just hearing about a lot of the research that you guys have going on in your lab, it's so exciting, because some of the things that you guys develop might help improve the quality of life for some of these patients.
Yeah, we hope so. I came into science as a purely basic scientist, thinking that I would spend all of my career trying to figure out how things work, how cells work, and how a neural network works to carry out a function. But for the last 20 years or so, which is 2/3 of my independent career as an independent scientist, it's entirely been translational, where we're trying to figure out what changes occur in the nervous system in inflammation or in functional GI disorders. What happens to serotonin signaling in these disorders, and which of the changes contribute to altered function and sensation, and what targets might be revealed through these studies that could be exploited to improve quality of life.
Yeah, so, and you're talking about asking yourself some of these questions, but can you briefly explain to us what you really hope to gain a better understanding about in order to really help patients suffering from any gastrointestinal disorder, specifically adults or children?
Yeah, well, that's kind of a tough question to answer, because I'm a PhD, and so I'm kind of limited to what I can do within my research lab. But on the other hand, I've got great relationships with physicians, gastroenterologists, and GI surgeons, both here at the University of Vermont and at other institutions. And they're interested in our work and interested in trying to apply what we're doing. So I'm hopeful that discoveries that we make in my lab including those that I mentioned, like luminally acting 5-HT4 agonists and bacterial treatment plans, could ultimately reach the clinic and reach the homes of individuals who are suffering from these disorders.
Yeah, it's all about teamwork and just finding ways to really help the patients on all levels and
Right.
aspects of research.
Absolutely. It's got to be partnerships.
Yes. Yeah. So, out of all of the research studies that you have been a part of, I mean, we know that research is important. All research that's going on in the field is very important. But what would you consider maybe being your most successful study and why?
Um, I think one of the highest impact studies that I've been involved in my career was the discovery that in individuals with irritable bowel syndrome, whether it be constipation predominant or diarrhea predominant, there's a change in serotonin signaling in the epithelial layer of their GI tract. And the change involves a decrease in expression and function of the serotonin transporter. So this is a molecule that acts as a sponge to remove serotonin from the interstitial space once serotonin is released and is having its actions. And this happens to be the same transporter that's the target of SSRIs that are used to treat depression. And so that discovery was important for a couple of reasons. One reason is that it was the first discovery of a change, a molecular change in the GI tracts of individuals with IBS. And that was really important at the time. This was, about 16, 17 years ago. And at that time, many people with functional GI disorders were referred by their primary physician or their primary caregiver to a psychologist or psychiatrist rather than to a gastroenterologist, because the feeling was that the cause of their disorder was in their head rather than in their GI tract. And our discovery that there's a fundamental change in a molecule in the GI tract that is involved in motility and secretion and sensation that could account. We still are not 100% sure how the cause and effect relationship here, but it puts the problem partly in the GI tracts of these people. And I think it was validating for people with IBS to know they feel it in their gut and they know something was different there. And so, and since that time, there have been a host of really carefully done studies validating our results and also showing other changes in the GI tracts of people with IBS, including low levels of inflammation that wouldn't be detected with normal tests. But if you look hard for it, you see that there are signs of inflammation there. And these pro-inflammatory molecules can be wreaking havoc with the GI tract, including lowering the transporter expression that I was talking about.
Yeah, and I think what's so cool about kind of what you're talking about here is just a lot of times patients are always saying how they go into these to the offices with their doctor and the tests come back normal, but they still feel the symptoms. They still
Yeah,
feel sick. So I think,
absolutely.
yeah, and I think with your studies is just really getting down to those nitty-gritty and the bottom line of what's the cause of this. And it's really nice just to hear that basic science is you were really doing the research here to figure out what's the bottom line so that we can validate the patients and
Right.
what they feel.
But just to underscore something I said earlier, this really has to be partnerships and team efforts. And so for us to be able to study human tissue in my basic science lab, it required a collaboration with Peter Moses, a gastroenterologist who at the time was here at UVM. And we had a medical student who took time out of med school and then ultimately did a PhD in my lab named Matt Coates. And he's now a gastroenterologist at Hershey Medical Center. These other studies, the 5-HT4 work has been done by a series of people who have come through my lab that I probably don't have the time to name now, but that's really part of the exciting thing about doing these projects is working with all of these people.
Yeah, working with so many people who have a connection in different areas and different locations, and just thinking of the variety of patients that people from your lab specifically are able to touch.
Right, right.
Yeah. So since 2013, we know that you won the IFFGD Research Award then, but did you receive any other acknowledgments for your research either before or after winning that IFFGD
Well,
award?
I've received a number of awards and kind of humbling experiences throughout my career. I think one of the ones that would be worth mentioning is I was made an endowed professor here at the University of Vermont in 2016. It's the Samuel W. Thayer Professorship, which is the oldest professorship, endowed professorship at my university. And so it was kind of exciting to be acknowledged with that. So that's one example.
Yeah, and just like we said at the beginning, acknowledgments are always good to kind of keep you pushing and keep going and just keep the morale up and motivated to continue on with the research that you're doing.
Absolutely.
Yeah, and speaking of just keeping up with the research that you're doing, what do you specifically enjoy about being a researcher and why?
Well, when people are asking me for career advice, I tell them that I think I like my job more than anybody I know in the world. And that's because I can have this great balance between research and teaching. When you're doing research, you have the opportunity to discover things that nobody knows about before you've discovered them. And if you're fortunate enough, as I have been, to be able to obtain the funds to answer the questions that I want to answer, it's incredibly exciting because I'm going into with my colleagues, with the people in my lab, going to unknown territory and answering fundamental questions about how our bodies work. And it can't get more exciting than that. Another great thing about it is the discoveries are really fun, but one of the other great things about it, one of the things that keeps me feeling young, is working with all of these people who come through my lab and working with them and also watching them pursue their careers, whether it be in biomedical research or whatever direction they end up going in. I've been really good at keeping in touch with the people who've come through my lab, and it's a real fellowship, and it's an extended family. So whenever anybody gets a PhD in my lab, I send out emails to basically everybody who's come through the lab, asking them to congratulate that person. And it's a really wonderful feeling. Also, as a professor, I get to balance that with the teaching that I do, which I also really enjoy. So I'm a lucky guy. I've managed to be at this career for a long time and have been able to do the things that I want to be doing and answering questions that I came up with or people with me came up with and have been in position to approach them.
Yeah, and it just really sounds like you have your hand in being able to really help advance the field of GI in the future in all aspects of just doing the research in your lab, but also teaching those who are coming after you. And I think that that's very commendable to even have the mindset of what you're doing today has an impact on the future of research,
Right.
and that's a phenomenal outlook on everything. So we've talked about this program, just about all of the research that is coming from your lab and all that you hope to understand about the research findings. But what do you still see as some of the gap needs in the field of research, and how do you foresee that your lab fulfills some of those needs?
Yeah. Well, I think one of the hard parts, and it really is very hard, is trying to figure out how to convert our basic science discoveries into something that can be used in the clinic. And this is really difficult. And we've experienced this in partnerships that we've had with pharmaceutical companies where um, they have to, I don't have the money to develop a drug and take it to market based on a discovery in my lab. So that has to be a partnership. And the pharmaceutical companies, these are for-profit organizations, and so they have to be able to make money on these ideas, or they have to get their money back from the investments that they're making. So and they have to make hard decisions because it costs millions and millions of dollars to take something from the translational basic science in the mouse level to something that has gone through FDA approval. And so this is where the hard part is trying to figure out what are the best ideas and the ideas that will have the most impact clinically, but also allow these companies to make enough money that they can keep moving forward. And so I think that's one of the hard things. And so for me, since I'm not, doing this to be at that end point of making money from my discoveries, I'm kind of keeping my mindset in my lab and keeping my interest in our current projects.
Yeah, and really probably just trying to find those ways to help bridge the gap of
Absolutely. And the thing is, these companies are open to ideas. They're looking for good ideas to move forward. And so they've been very receptive to discussions, and I've had good partnerships with them.
Yeah, and like I said, just kind of bridging the gap between the patient and your findings as well, and just trying to figure out the common ground of what can we do with these discoveries, and what questions do the patients have.
Yeah, absolutely.
Yeah.
Well, and that's something that I think the IFFGD has done incredibly well. It's a great foundation/institution, and it's a wonderful patient advocacy group for individuals in this unfortunate, frustrating situation. These are disorders that are frustrating for the patients and also the caregivers alike, because there are no easy answers. There are no easy answers in terms of the diagnostic end of it, and there are no easy answers for the treatment end of it. And so the patient is frustrated because they're not getting a clear answer, and the doctor is frustrated because they can't come up with an easy, good solution in many cases.
Yeah, definitely a tremendous impact on the quality of life for many patients out there. But
absolutely,
it's like what you said before, just all of us coming together and just really working together so that in a whole, as we continue to raise awareness about the GI disorders, hopefully sometime in the future, we find the light at the end of the tunnel and can continue to help patients manage and cope with these disorders.
Absolutely.
Yeah. So thank you so much for joining us today. It's been a pleasure speaking with you, Dr. Gary Mawe. And thank you so much, everyone else who has tuned in and joined us to watch the IFFGD Research Award winner series, Where Are They Now?, where we've really had a pleasure of speaking with Dr. Gary Mawe and just learning about his journey through research. So again, thank you.
Thank you.